This program was brought to you by Organo Gold. Organo Gold is a health and wellness company that provides healthy coffees, teas, and chocolate. All one has to do is consume the available coffee, teas, chocolate, and other products to get all the available benefits. One can also share these products with others to help them improve their health as well.
And now, FAIRFAX Breakfast Club with your host, Basil Lemba.
Welcome to the FAIRFAX Breakfast Club show. My name is Basil Lemba and I will be your host. The FAIRFAX Breakfast Club is a weekly program in which we bring to you valuable and workable know-how you can use to improve your networking skills and grow your business. We always start the show with a quote, and today's quote is, "We have now just enshrined, as soon as I sign this bill, the core principle that everybody should have some basic security when it comes to their healthcare." And that's from President Obama. With us today in the studio, we have someone who's very much involved in the healthcare, and I invited him so he can present to you an aspect of the healthcare that you may not have heard of before. His name is Rahman Parker. Hello, Rahman.
How you doing? Great to see you today, brother.
Same here.
Yeah, thanks for having me.
My pleasure.
All right.
So now you happen to be steeped into the healthcare.
Steve is a good word.
Tell us about it and tell us what you're doing.
So again, I'm Chairman and Chief Executive for Rahman Healthcare, managing affordable human needs. The idea is that we have three focuses when it comes to healthcare: health education, program evaluation, and also health systems development.
Okay.
Health systems development is the piece that we're talking about, the infrastructure of the U.S. healthcare system.
Okay.
And we want to be able to change the business of that, and so that's what my goal is.
Okay. So what do you propose?
I have a 4-point plan that helps to bolster the current infrastructure of U.S. healthcare system. I've studied 8 different healthcare systems around the world, and I've studied what they've done well and what they've done not so well. And so I've taken both approaches, and I've been able to put together the 4 essential things that one would need in order to make sure that healthcare is really delivered to the community as a whole.
Okay.
Yeah.
Now I have a question for you there. I know last time we met, you mentioned to me how healthcare was born in different countries, the different circumstances. Can you cover that, please?
Yeah, we had talked before that universal health systems, based on the 8 that I've looked at, have come under a couple different concentrations and different situations. First would be under financial ruin, right, or under some type of chaos. So either an organization or a society has gotten to a point where they can no longer take care of themselves and government is not providing for the people. And so services are then rendered by the government through funding or private funding. It brings it in and starts to build up the healthcare of a community and identify the needs that way from zero all the way to built up to complete infrastructure. Okay. Also, it could come after as a result of chaos or war. 1948, the National Health Service came to the United Kingdom for that same reason. After World War II, they were decimated. And so it was a way to build up again from zero, all the way back up to a complete system that took care of the people comprehensively. Okay. And so what's happening in the United States is that we haven't had complete zero for either one of those situations. Okay. What we have is more of a middle ground. And we're looking to build up a complete infrastructure on a middle ground. And that's what makes it so new. That's what makes it so different. And we can take some lessons learned from some of those other systems. And what happens is that when we're putting on top of something that's halfway built, it looks like it's already done. And we're far from being finished with healthcare.
Okay. Now, to get back to your 4 points, you mentioned the first one, which was?
Well, the first point would be to take a look at how patients are being insured. Okay. How patients are being insured is important because what type of care you may need at a specific time will be better to address than what our current model has. And so looking at particular ways to customize the needs of different communities is a great approach for that.
Okay.
The second would be to take a look at the people, of course.
Yeah, sure.
I mean, healthcare is for the people. Based on what you're quoting, what the president's saying, you know, everyone has the idea that everyone really needs quality, unique care. And so from that standpoint, if we're able to deliver quality, unique care, we have to know exactly what the people need. And so we need to do needs assessments and those type of things to identify population health and start practicing public health medicine in America. So the third would be looking at providers, those who are taking care of the people, right? That would be
that include the insurance and the hospital and everything else.
Right. So that's
so far now providers seems to mean insurance only. I mean, I maybe have it wrong, but that's
well from a healthcare standpoint. Provider would mean the person providing the care, like the physician.
Okay.
So physician, the nurse, any allied health professional, anyone who's working in that capacity, we need to take care of them. We need to start giving more rights to the provider.
more rights.
Right.
Not more money. That's not what you mean when you talk about taking care of.
Well, money can come from rights.
Oh.
Right. So we can enact policies to change the way things are delivered.
Oh, I see what you mean.
could
Okay,
change
okay, I get
healthcare
it.
times.
Okay, okay.
Really, that's and this piece, the third piece, is really essential because that's the people power of this. Aside from what the patients need, which automatically is first and should come first, the provider's autonomy, what they can choose to do, bill and not to bill, those should be taken into consideration. And I think that at this point, when we're looking at providers, we need to make sure that they have the wherewithal to understand that they're an intricate part of the plan. And if we have more people interested in medicine and healthcare, like with STEM initiatives, if we're eliciting people in the science and technology pieces of that, we can put physicians and nurses right in that same category. Okay. So if we can just add some more people power, that'd be great. Okay. And then the fourth piece and the final piece would be able to try to look at this system and replicate it, and so that we can put it in places where it's specifically needed. We have some of these systems already in place, and they're called safety nets. Right.
Tell me more.
I wanted to explain more. So,
Okay.
so traditionally we have hospital systems that are set up, right?
Yes.
And so outside of that, we have some people who are uninsured. And when they're uninsured, they're visiting the emergency rooms. They're doing that at such a clip that the hospital ends up having to say, hey, I have to take a look at this. I have some money set aside for charity care, but if I'm spending too much of that, what if somebody comes in and I can't afford to take care of them the way that I want to, or the care that I say that I want to deliver? I need to find a way to reduce that. So what needs to happen is they fall into what we call a safety net, and that would be in the free clinic system and in the Medicare and Medicaid clinic systems that we currently have in this region. We have several in the region. Okay. And so the idea is to help bolster that infrastructure itself. And my thought is if we can take care of this piece, we can actually see the hospitals take care of themselves that way.
Explain to me how you come to that conclusion.
Well, because if, let's say, for example, we're playing a game of Jenga. Have you played Jenga before?
No, I have not.
So we build up wooden pieces, right, to a tower. And you and I would take turns taking out pieces in that tower. Ultimately making sure the piece I take out doesn't destroy the entire tower. So in this situation, if I'm taking people out of the system, right, because they can't afford it, right, I'm lowering the stability of my system, right? So I want to make sure that I'm not taking out the most viable piece that ends up knocking the entire tower down. Okay. And so the safety net acts almost like a Jenga tower in a way. They're critical pieces to our infrastructure for the healthcare system that most people don't focus on. Most focus on insurance. We focus on doctors. We focus on pharmaceutical companies, right? Sure. But this one particular focus of this safety net, if you will, of catching those individuals who can't afford the care, and then offering an existing system customized to their needs, helps to take the load off of this tower we've made so it doesn't fall. Right, so that's what I'm looking to focus on particularly, because if we can take care of the net, then we can make sure our infrastructure is actually sound.
Oh, because based on your prior statement, the country already have a system as opposed to the London and the other country has nothing.
Correct.
We have something.
We had something.
The idea would be now, if I understand you well, is to take care of the people, safety net people cannot afford it, and while keep the structure going. Right,
because there's some that can, and some that cannot.
That's true.
And so by lumping everyone together, we start to create a bottleneck in the system.
Gotcha.
And if we run in a systematic process, where we have bottlenecks is where we have issues in service, increased utilization rates, and then we have issues with kind of a cascading event of issues that come from not being able to see everybody at once. And so because you may have different care needs than I do, your family may have different ones than mine, we want to make sure that everyone's getting the quality, unique care they deserve.
Could we say, lack of a better word, two tracks? The track for those who have the money, can afford it here, and then the system is proposing the safety net for people who do not have it. Now the question I have for you is, how do you fund the safety net?
How do you fund the safety net? Good question. So who's actually responsible for the safety net? Everyone. So that's the quick answer, but to be specific, the hospitals would have to help fund the safety net, and they currently do.
They have to help, so who else would have to? Meaning, let me try to understand. Let's say I pay for insurance. So are you saying that some of this money could be taken to fund the safety net? Is that the statement?
It could be. Okay. So the insurers could help fund the safety net too. Okay. That could be another option. There are a lot of things that we could put on the table to make a payer system that gives multiple streams of funding to these safety net groups. That makes this net more sustainable. Okay. Because without that sustainability, we all end up paying in the end anyway for those who are uninsured, based on the fact that they may be in a higher risk pool due to illness or lack of having services at a frequency that would have kept them more healthy.
There was, during the debate, there was that statement, escape me, with healthcare, I guess it was final question to the presidential debate, was the healthcare, is that a right or what was the other one?
Is healthcare a right or a privilege?
Yes, right or privilege.
This is a very popular debate. You want my answer on that? Because I can give my...
Please, that's what you're here. This is your chance, isn't it?
I think so. So is healthcare a right or a privilege? It's one of these questions in life, I think, that we're probably putting the wrong words to. And we could get a better answer if we change some of the words.
I tend to think so, yeah.
Right. So we could change it to be, is healthcare something we have to have or something that we need to have? So we could look at the answer as healthcare is what we need to have. Well, because we all need to be healthy, right? I need to make sure that I get adequate sleep, not only to be on your show here today so I can look nice, but also I need to make sure I'm getting adequate rest so that my circadian rhythm isn't messed up. So I'm not sleeping during the day while I'm at work, right? I need to make sure I'm getting adequate meals at home that are giving me the right amount of nutrients and those sort of things. I need to exercise properly, right? I need to have enough water, right? So all these things are almost at a basic level things that I can do to help to empower my own healthcare, right? And so my idea is this: if we can get people to see the power of having control over their own healthcare, we really can see the impossible happen. We can see diseases eradicated. We can talk to one another about various cancers and where to get them taken care of. We're the best places and the best physicians that are specialists in these things to get these things done. And if someone can't afford it, we could put a community of help around that person and give them the resources that they need, be it financial, emotional, spiritual, all these things that take care of the entire health of a person. So it's something we need to have. Right? So rather it being a right privilege argument, it really should be something we have to or we need to, and we all need to. Right.
I guess it comes down to taking care of people, taking care of everyone.
Right.
It's not a matter of, it's a privilege or a right.
Right.
We have bodies, something happened to bodies.
That's right.
So, and they need to be taken care of. I guess it's as simple as that. How to go about it is another story.
That's right.
But from what you're saying and what you just mentioned, seems to me that education will play a major part in health.
This is why it's the first option that I offer of Mon Healthcare is health education. We offer a product called Learn, Teach, Empower, and it's a 3-step process that we can get people to understand better health and better systems. So if it has to be with diabetes, or if it happens to be with chronic illness, or if it's something that's more acute, like traffic injuries or wherever it may be around the world, Learn, Teach, Empower helps people to learn about what the issue may be around diabetes or tragic accident or traffic incidents. We can then teach those who are susceptible to these issues the best ways around them or the best ways to eliminate the issues that are causing some of these things that get them to the diabetes issue, that get them to the other healthcare issues they have. And then in the empower piece. So not only are we handing out, opportunities of information and packets, we're also giving people the opportunity to tell someone else about it. So once you've gone through the learning process and the teaching process, essentially, especially if you experience something, you're almost an expert on it in a way, within your case. And so if you can deliver that message to someone else, hey, put down this instead. Walk 20 miles instead in the next month and see how you feel. Drink more water instead of the soda that you have before you go to sleep and see how you feel. Just someone sharing that information among people, like you said, can really be a powerful tool. And so the learn, teach, empower process is part of the health education model we have. And you're right, it does come first. Because once we understand what the issues are, then understand how to take care of them, I can take care of myself, and then I can take care of others. Right.
It's very interesting because people go to school for years, this, that, the other thing, but my take is that sometimes the basics in life are not taught in school. It seems to me that people should be taught these things, how to take care of oneself. I give a dramatic example, or simple to prove the point, not to prove the point, allow us to state the point. The 3 R's, what are they? Write, read, and arithmetics.
Right.
They're telling you these are the basics.
Right.
In that, there is no taking care of yourself.
It's true. The one piece that they're asking to take care of themselves, I guess.
It's not part of any curriculum, and nothing. We talk about telling people you should do your exercise, you should watch what you eat, what have you. Well, it comes from at some point or another, when you're 50, 60 years old or whatever, something happened, and then all of a sudden, and then we see the light. And we say, well, you know what, you should maybe watch, or maybe you should watch for soda or what have you. But that's probably, to me, that's one of the more fundamental points. If we talk about healthcare, nobody's talking about how to teach people something about health starting in kindergarten.
And so now what you're talking about is a focus away from reactionary health care to preventive health care, right? How we can prevent things from happening. We don't really talk about that a lot, do they?
We never. I guess that's the problem. You get knows about this, that, the other thing, but I think we don't go to the fundamental, the basics of it. And we all know we take care of our cars much better than we take care of our own bodies.
Oh yeah, you'd be surprised. So after these snowstorms we have a series of storms over and over again, and this pre-spring we've had that's covered in white. I think it's beautiful. What I find interesting, as soon as the snow stops, the line for the car wash is out the door. In comparison, the line for the doctors is out of the door too, because
the line
people
for what?
outside the doctor's office is also out the door too.
Oh, really?
But the issue is what happens first. On the way to the doctor's office, we're probably going to get our car washed. So speaking exactly to what you're saying, it's an outward appearance thing, right? So we as people have these id and these ego things that we have to take care of, right? And our focus, which I completely agree with you, should be on taking care of ourselves. Now, I regionally specific in the United States especially, I think there are other regions that may have that focus. I know here in our nation's capital, there are plenty of people you see running around the malls all the time, lots of energy, you see a lot of runners. We have a Marine Corps marathon here in Washington, D.C. as well. So there are a lot of positive things that are done here too, but also geographically speaking, we hurry, rush, and do a lot of things fast here. Well, just like in New York City, sometimes the outward appearance is probably more of a focus than what's going on the inside until what's
something
going on the
goes
inside
wrong.
shows on the outside.
Absolutely. But you're absolutely right. But that's what I'm saying, that we hear all the debates about healthcare, people are for it, people are against it, and da-da-da-da. Forget about healthcare. These are people.
That's right.
They have bodies.
That's right.
Shouldn't we, at a very early age, put a program in school? Now, that they study, you can't force somebody to study, but at least put it there where they are supposed to be educated on healthcare, on education.
Yes.
That's my point. It does not exist.
Right.
Later on, it's a big fight. Everybody's screaming and yelling and da-da-da-da. Even if you fix it and put it there, seems to me that the basics is not done. Here, teach them what kind of food, what have you. Check yourself, which food works well for you. Exercise, and this, that, the other thing. Those very basics are not in place. And then you wind up with a big fat bill on the other side.
And so by using the preventative health side, what we're able to do is reduce that big bill on the other side that you have. You're also able to take care of things up front. So teaching children is the absolute way to do that. MyPlate.gov is something that the president's put in place and the administration's put in place that indicates proper nutrition for meals and how you can set up a plate. It's a good start. It's a template. It is not the complete answer.
Well,
and I find that a lot of time in our society, we're waiting for someone to give us an answer as to how we should do something, and we really have the answer inside of ourselves.
That's right.
And so it's time now, I believe, more than ever, especially with health education, educating ourselves on what's right for what our community needs, and what specifically to what people need in order to get to a point where they can change the discussion from, well, grandma had cancer, my sister had cancer, so I'm probably gonna have it too, and if I have kids, they may have it too. So instead of living in that reality that really is one that ends with no hope, and it ends up being a disposition rather than a chance to change what you want from a preventative health side. So if we can start that early, like you said, with children, I think it would be great. Learn, Teach, Empower works at any age. And looking at other existing programs that happen around the nation, you do find that there are some early education programs that are doing that, but they're not at a clip where we're starting to see an epidemic of health education. I'd love to see that.
Well, it has to be. I think there is as I said, we all know that, sometimes we mention that there is a miss. The definition of education is putting into people's hands the information they need in order to survive.
Correct.
Talking about surviving, is health important? The answer, I believe, is yes and no. I don't even believe. I know is yes. But that you do not find a program at the early age, there is something off. Period.
Right. Because that's the way allopathic medicine has been in the United States. This is the way we treat, see, and not prevent and cure. So when we get to the prevention and cure piece, and then look for the next person who has that issue and help them to prevent and cure it, rather than saying, well, I see you have this issue, I'll give you this because it treats this, and then I'll give you this too because it treats that other thing. If we stop cascading the issue for whatever the gain may be, I'm not sure what it is really. There are many thoughts on that. But if we stop cascading the gains and rather get to a point where we're preventing and curing, or prevention and eradication is a good way to say it from a public health standpoint, we'll be able to see different organizations and different groups and societies and people living differently, and ultimately focus on each other. Hey, look, my grandmother got through that. It's no problem. Look, I know this guy, or I know this young lady. Here's their card. Go talk to them. Tell them I told you to come. And they're going to help you out with what you need. And then someone, instead of having that discussion where grandma had it, my sister had it, so now I'm going to have it, or my kids are going to have it. Now there's a hope. And so my goal really while I'm here is to understand that we can provide people with hope by helping to educate them properly, evaluating programs, and looking at a system approach or helicopter approach to the entire area, and saying what is the metropolitan Washington, D.C. area really need for health care? What do the people of Virginia need? What does Maryland need? What does the district need? What are the needs in the Eastern Panhandle, West Virginia? What are the needs in these regions? And how can we specifically address them each based on what the people in the community have decided they need?
I have an idea.
I want to hear your idea. I like ideas.
Now, I have the idea of this will be like a slogan.
Okay.
Moving the country from healthcare to wellness.
I like that. Did you write that down?
Oh, you can write it down now.
Can I take it?
I won't bill you for that.
Good.
From healthcare to wellness.
I like that.
That's where it's at.
And there are organizations who are doing that. And I think that we're getting to a point where people are understanding this is important. So rather than just insuring ourselves in case something happens and paying for that opportunity, we get to a point, to your point, that wellness, where everyday actions, right, add up to my general well-being.
Absolutely.
Right, and so I think that's the preventive measure that we need.
Very good.
Thanks.
Quickly, I want to mention here, he will be coming at our expo we have on June 20th.
Yes.
So if you don't have it, this is just 30-minute show. That's not enough. We'll be there for 5 hours, by the way.
5 hours.
On June 20th.
Ooh, okay. All right. All right. I'll be there.
From 8 to 2 at the Stacy Sherwood Community Center. Or also, you may also see him if you come to our breakfast event, because we'll be coming at every third Thursday of the month at the Old Town Hall in Fairfax, 3999 University Drive. Any final word you'd like to communicate, Mr. Rahman Parker?
From this point, again, I think that if we can, like I said in the beginning, if we can get people to see the power of having control of their own health care, we really can see the impossible happen. We can see diseases going away. We can see families healed, not only medically, but also connected, thinking that hope is not there. We want to be able to provide people with care, but more importantly, we want to, in health, go from health to wellness, and in doing that, providing people with hope.
Absolutely. Yeah, to your point, absolutely. Your first wealth is health.
Absolutely.
Because if you don't have health, then
what else do you have?
what do you have? Can even enjoy. Even if you have all the money in the world,
Exactly.
you cannot even enjoy them because you don't have health.
Right.
So that's what I want to invite you over here, so we can provide you guys with some more information in these aspects so vital. And also, so we can handle it well. Healthcare, it's at least a solution. It's something. Somebody did something about it. And now, at any major program, we need twinning. We need to tweak it, and this, that, the other thing. But we just want to wish to every one of you a very good health. And I thank you very much, sir, for coming.
Thank you for your time. I appreciate it. It was great seeing you today. Yeah.
My pleasure. As always, have a good night. Bye-bye.
Thanks.
This program was brought to you by Organo Gold. Organo Gold is a health and wellness company that provides healthy coffees, teas, and chocolate. All one has to do is consume the available coffee, teas, chocolate, and other products to get all the available benefits. One can also share these products with others to help them improve their health as well.